My name is Nirav Shah. I'm the director of Maine Center for Disease Control and Prevention. Delighted to be able to join you this afternoon to talk about where we are with respect to COVID-19 for today, Tuesday, May 4th, 2021. Right now across the state, there are a total of 62,509 cases of COVID-19, an increase of 417 cases since yesterday. And of the 417 cases that were created yesterday, 169 were from May 3rd, 67 were from May 2nd, 111 were from May 1st, and the remainder were from April 30th. Sadly, we've had a total of 790 deaths to date related to COVID-19. And cumulatively, 1,872 people have been hospitalized. Right now in Maine, 126 people are currently in the hospital with COVID-19. 56 of them are in the intensive care unit, and 24 of them are on a ventilator. Turning to testing, where our 7-day positivity rate for tests done for COVID-19 now stands at 2.65%. And our testing volume for PCR tests now stands at 677 PCR tests for every 100,000 people in Maine. In terms of vaccinations, Maine has administered as a state 1,176,794 total doses of COVID-19 vaccine. What that means is that among eligible Mainers, 57% have received their first dose of vaccine, and 47% have received all the shots they need. We are continuing to make progress on the vaccination front. And finally, a couple of announcements as it relates to vaccines and the ability to get a vaccine. The first is a change in our policy around residency. Starting today, Maine is removing the residency requirement to get a COVID-19 vaccine. Previously, in order to receive a COVID-19 vaccine, you had to be a resident of the state, which meant that you either had to live or study here. But going forward, effective immediately, what governs whether you can get a COVID-19 vaccine in Maine is whether you are in Maine and if you are over the age of 16. If you're in Maine and you're over the age of 16, going forward, you can get a shot. Now, why are we making this change? Well, there's a couple of things going on. The first is more people coming to Maine and coming back to Maine. There's also more vaccine that's available across the country as well as across the state. This change, removing the residency requirement, makes it easier for people who give shots. It also makes it easier for people to get shots. Now, this change is not being made because people don't want the vaccine. Rather, it's a recognition of the ever-evolving vaccination landscape. For example, with college students coming back home, we want to make it as easy as possible for them to get their first shot or their second shot. We've also heard from vaccination sites that removing make it even easier and quicker for them to administer doses. The second thing I wanted to touch on are some upcoming vaccination opportunities. The first is the mobile unit that we are operating in partnership with our colleagues at FEMA. Starting tomorrow, it will be in Turner in Androscoggin County at the Boofy-Quimby Field, starting tomorrow for 3 days of operations, administering the Johnson & Johnson vaccine. You can take advantage of that and no appointment is needed. And so if you are in the Turner area or that part of Androscoggin County, feel free to get your Johnson & Johnson vaccine at the mobile unit at Boofy-Quimby Field, starting tomorrow for 3 days. After that appearance in Turner, the mobile unit will then be going to Waterville, where again, vaccination will be offered via the Johnson & Johnson vaccine. You can make an appointment or walk-in appointments will also be available, both in Turner as well as in Waterville. The next opportunity that I wanted to take a moment to shine a spotlight on is down in Sanford. The Sanford vaccination site in the old Marshall's building is not only doing walk-in hours, but also evening walk-in hours. We know that for a lot of folks, taking time off of work during the day is a challenge. And that's why the Sanford vaccination site this Thursday will be having a special clinic in the evening for walk-ins. So that will be from 5 p.m. to 8 p.m. down in Sanford at the old Marshalls. From 5 p.m. to 8 p.m., they will be administering vaccine on a walk-in basis in the evening. And so if you've been hoping to be able to get your shot, but your schedule just hasn't allowed you to take time off in the early morning or during the day, this is an opportunity for those of you in Southern Maine in an after-hours fashion to get your shot. One additional note there is the cost of vaccines, which for a patient is free. Something we've talked about and something that we've gotten some questions on lately. So I wanted to remind folks that if cost has been a barrier or a concern of yours when it comes to going to get your COVID shot, please know that from a patient's perspective, the COVID-19 vaccine is free. And finally, one other update on the epidemiology front around variants. I just wanted to take a moment to review what we have in terms of the numbers of variants that have been detected, and then provide a little bit of color around variants themselves. Let's start with the numbers. For the P1 variant, we've detected thus far in Maine 22 instances. For the 351 variant, 3 instances. For the 117 variant, 153 samples have tested positive. There are also 2 other variants that the US CDC has deemed to be what are called variants of concern. And we've also detected both of those in Maine. One of them is the B1427 variant, which we have detected 3 cases of. And the final one is the B1429 variant, where we've detected 105 cases. Now, we are continuing our efforts to sequence samples of COVID-19 as they come in to be on the lookout for all of these variants. These variants are a concern, and I know that they raise a lot of questions. So here's the bottom line when it comes to variants. You can do your part to protect yourself and your family from these variants, as well as to reduce the overall case numbers in Maine by doing one thing, and that's getting vaccinated. Thankfully, the 3 vaccines that we have right now in the United States have shown strong effectiveness against all of the variants that have been detected and categorized by the US CDC. But more generally, I think it's also important to note that the risk that are posed by variants coming here is not necessarily that variants will come here from other states. The concern that's in front of us is not so much preventing variants from coming in from other states, but rather preventing the spread of the variants that are already here. The main concern from variants is tamping down on any transmission of the ones that are already here. The best way to do that is for as many people to get vaccinated, because by being vaccinated, you prevent yourself from being used as a vector that could inadvertently transmit the virus or the variant to somebody else. We're all concerned about these variants. Indeed, they push all the scary buttons. But the best thing that you can do to help yourself out, to help your neighbors out, to help the entire state out, is to go get vaccinated, because the vaccines are tremendously effective against the variants, even though those variants are more contagious and in some cases, even more likely to land people in the hospital. So with that, I'm going to turn things over to our colleagues in the media today. The first question goes to Megan from WMTW.
Thanks for taking my question. There has been some reporting that the Biden administration is going to be changing the way it allocates vaccine to states. In fact, I think the president is expected to speak about it momentarily. basically shifting away from like a population-based allotment toward, demand for vaccine for states. Do we have any idea how that may impact what we get in the coming weeks or what we ask for?
Sure. Megan, I'm familiar with what you're referring to, and a few factual notes first. This is not a change in the fundamental mechanism around which doses will be allocated. That is to say, what the Biden administration is doing is recognizing that some states, not Maine, but some other states, are not ordering all of the allocated doses that they receive on a given week. So what the administration is allowing states to do is for states that would like to get more vaccine to order off of the unallocated doses from other states. So in effect, if a bunch of states don't order up to their cap, those unordered doses will be placed into a federal pool. And states that wish on a given week to get additional vaccine can tap into that federal pool and potentially obtain more vaccine. This change does not alter the fundamental basis upon which vaccines are allocated, which is by population. It merely is a recognition that balancing supply and demand may mean allowing states that have a lot of demand to be able to tap into the supply that is left unordered in a particular given week. It won't mean anything fundamentally different for Maine. What it will mean is that if we get into a situation where we need more doses because of whatever reason, we may have the opportunity to tap into that federal pool in a particular given week.
Thank you.
This is a series of conversations that I've had the pleasure of being involved with, and this is a move that I certainly support, given that we are still seeing strong demand for vaccination in this part of the country, and there is less demand for vaccination in other parts of the country.
If I could just follow up really quickly, actually switching gears. Is the state beginning any plans ahead of the expected expansion of the approval for the Pfizer vaccine to 12 to 15-year-olds? I know we're a little ways off from that, but I just wanted to know what your message to parents might be.
Yep. Thanks, Megan. And that also is a development that we've been following, and we will see what the US FDA does if and when they make any announcements next week. But our message here is that we'll be ready. We've been anticipating the possibility of expanded eligibility of the Pfizer vaccine for 12 to 15-year-olds for several weeks now, since Pfizer made the official request to the US FDA. Now, obtaining vaccine of the Pfizer variety may be a challenge initially because, as folks are now aware, the Pfizer vaccine has that ultra cold storage requirement attached to it. So we have been working with providers for weeks now to understand which of them have the ultra cold storage capacity and which of them would like to offer it to patients and those in their communities. Thankfully, we've received robust interest from across the state, from Aroostook County down to York County. We've had providers reach out to us and say, we would like some of the Pfizer vaccine for 12 to 15-year-olds or 12 to 17-year-olds. So we're prepared to make those allocations to meet the needs of folks, starting whenever the US FDA amends the EUA. My message to parents is to strongly and seriously consider getting their 12 to 15-year-olds, 12 to 17-year-olds to get them vaccinated. Even though the overall risk of serious side effects from COVID-19 in that age group is low, it's not zero. We've had instances in Maine and in the Northeast of even young people, 12, 13, 14-year-olds, adolescents, who have had serious consequences related to COVID-19. But even if it's not just about their kids' health, I recommend that parents ask themselves, do our kids spend time with folks who are elderly, folks who may have weakened immune systems? Getting vaccinated lowers the likelihood of accidentally infecting anyone who's elderly in their community that much greater. So I think it's the right thing to do. We are awaiting final authorization from the FDA if and when that comes. And if that happens, we'll be ready.
Thank you.
Let me turn next to Eric Russell.
Good afternoon, Dr. Shah. Thanks for taking the time. I had a couple of questions about vaccinations. It looks like if we look at the daily totals from Saturday and from Monday, they're quite a bit lower than what we've seen the last several weeks. I think they're both below 10,000 for the first time in more than a month. Now, some of this was anticipated as we've moved into a different sort of phase in vaccinations, but is this drop more precipitous than you thought?
Eric, I've been looking at those numbers as well, and that's there are some concerns there. But one note there, Eric. You're right. So in terms of what was logged on Saturday, which would have been reported on Sunday, was about 8,000 doses, and then subsequent to that, what was logged on Monday, reported on Sunday, would have been about 2,193 doses. That is a bit lower than we've seen in previous Saturdays and Sundays, although it is consistent with what's happened elsewhere across the country, as well as in the Northeast, which is starting to see a slowdown. So that's not welcome, but it's not unanticipated either. Eric, the additional thing that I've noticed in the data that I'm speaking with our team about is that it's not so much the total doses, but the composition of those doses. That is to say, what we're seeing a lot of are second or final doses. If you kind of look at each of those numbers at the ratio of second or final versus first doses, you're sort of seeing a 2-to-1 or a 2.5-to-1 ratio, which suggests that once we move through those who are right now getting their second doses, we might even have another slowdown. So we're doing our part to try to get the word out, as well as you heard me talk about today, expand not only to walk-ins, but also evening hours as well.
Thank you. The second question I had is, there's been a lot of talk over the last couple of days about whether or not we're going to reach herd immunity. And I know a lot of public health experts are saying that's not likely in the future and maybe not ever. Now, I know you've been more positive than others, but I just wanted to get your sense of, given what everybody else seems to be saying, has your stance changed on that? And if it hasn't, I guess, or even if it has, what does it look like as we sort of, debate over the next few months of whether we're actually going to reach this magical number or not?
Yeah, Eric, that latter question, I think, is where the action is. Because ever since the beginning of the pandemic, we've all sort of had this notion of herd immunity as the end point, as the time in which we would say, okay, well, I guess we're done now. But as we've discussed, and as you've heard me and others note, herd immunity is not a magical threshold or this talismanic thing where once we get to whatever that number is, we unfurl a banner, turn the lights off, and say mission accomplished. That's not how it is. It's a gradual thing, and the closer you creep toward it, the more effective it becomes. What it signifies really in epidemiological terms is when you've moved beyond that threshold, whatever it is, and there's not even a single threshold, it may differ county by county, city by city, based on demographics. But when you move beyond that, what it means is that levels of disease can fall so low that even those who are not vaccinated effectively enjoy the benefits of vaccination. But that should not be taken to mean that even if you don't reach that point, vaccines are for naught. Indeed, case counts start falling well in advance of reaching whatever that threshold is. And in many countries that are a good bit ahead of the United States, case counts have fallen dramatically, like in Israel, even though they haven't reached, again, whatever that threshold is. So for me, it's not the goal. It's not, it's not herd immunity or bust. It's let's get as far down that process as we can. And whether that number is 70, 80, 85%, let's just keep working toward that. I don't have a sense of whether we will get to 85 or 87%, because if we don't, that's okay, because I want to just keep plugging away at it. Each additional person we vaccinate brings us that many people that can be infected. That's really fundamentally what matters.
Thank you, Dr. Shah.
Mm-hmm. One note that is important, Eric, and this is it's a little in the weeds, but it is really important. Um, the thresholds for what constitutes population level immunity have changed. Early on, many epidemiologists thought it was on the order of maybe 65% of the population. You may have noted, or others may have noted, that that estimate has been upwardly revised in recent weeks and months. You may ask yourself why. That is fundamentally because of the predominance and prevalence of variants. What governs herd immunity levels is how contagious the bug in question is. And the more contagious something is, the higher that threshold becomes. And herd immunity projections have gone up in recent months, largely because of the spread of variants. Again, I'm not sure whether we will get there, but as my friend Justin used to say, if anyone's going to get there, it's going to be me, as in the state. All right, turning next to Patty White.
Thanks, Dr. Shah. And I apologize if you said this, my Zoom froze on me temporarily, but in terms of opening up eligibility to people from out of state for the vaccine, what if someone's only going to be here, or if they're not going to be in Maine for their second dose? Is that going to be potentially problematic, or enough states opening up eligibility where it won't be an issue?
It's more the latter, Patty. We've seen that other states in similar fashion have removed the residency requirement. So we don't see this as a barrier. Similarly, Patty, not long ago, last week, the Biden administration, in connection with the pharmacy program, the retail pharmacy program, indicated that, for example, a college student could get their first dose wherever they happen to be going to college, and then get their second dose at any retail pharmacy across the country. This change mirrors that. So if someone happens to get their first dose in another state and then comes back to Maine when it's time for their second dose, or vice versa, they get their first dose here and then happen to be somewhere else for their second dose, there is enough eligibility across the country now, be it at the state level or the pharmacy level, where getting that second dose should not be something that needs to be delayed. I still recommend that folks plan it out so that if possible, you're in the same place for your first and second dose. It makes record keeping easier. It makes knowing where you're going to go that much easier. But if you can't, there's enough eligibility now.
Okay, great. And we know it's important for everyone who is eligible to get the vaccine, but given that cases are now largely being driven by younger people, can you just talk about why it's important specifically for teens and young adults to get vaccinated, what that could do to the total case count in Maine?
That's exactly. Thank you, Patty. What sort of happened in Maine and I think maybe a few other states, but in Maine, is we sort of have two populations. One population that is older, that has been quite well vaccinated, for whom we are not seeing many cases, and thankfully not as many hospitalizations and deaths. The other population is those who trend on the younger side, for whom vaccination rates are not where I'd wish them to be. And sadly, that is generating a high number of cases, hospitalizations, as well as even deaths. The importance of being vaccinated for this younger group, especially now as we think about 12, 13, 14, and 15-year-olds, the importance is twofold. The first is for themselves. We've seen that even 20-year-olds are not entirely immune to even dying from COVID. We've had 2 deaths among 20-year-olds just in the recent few weeks. So the first reason for that group to get vaccinated is for their own health. But as we've seen throughout the pandemic, none of us is an island. And so the other reason for that group to get vaccinated is for the health and safety of their family and their communities. Because even though that younger group may not suffer the most terrible effects of COVID, they could still inadvertently spread it. And for example, in older folks, although the vaccine is still spectacularly effective, older folks may not have the same robust response to the vaccine as a younger person would. That's true with any vaccine. So the best way to keep older family members safe is for everybody in the family, soon down to even 12-year-olds, to get vaccinated. That keeps everyone safer. It also helps tamp down on the spread of things like variants.
Thank you.
Over to Brian Sullivan next.
Thanks, Dr. Shah. I wonder, is it okay for people in the state to get their first dose somewhere and second dose at a different location, or would you prefer it be in the same spot?
All things equal, I think it's just good practice to get your first and second doses at the same place. It's not a requirement. I say that more for prudential reasons. For example, when you're going to go to the same place for your second shot, you know where you're going, you know how the setup works, you know what the protocols are, you just know all of those things, and it makes it that much smoother. But in this new phase, Brian, where there's more vaccine, there's more administration sites, and folks are starting to travel more, if the best way for you to get vaccinated is your first dose somewhere else and your second dose in Maine, then we'll make that option work. And that's what, in effect, removing the residency requirement helps us do.
And just ask that the person do their due diligence and cancel the second appointment they probably set up.
You are absolutely right, Brian. In fact, I'm really glad you mentioned that, because something that's been happening more and more, and I get why, but since you raised it, for example, at our mobile unit, we've had a lot of no-shows. And I get why, right? Folks make a lot of appointments, you take the first one available. But what really helps us out is if you go through and go back and cancel the other appointments you made, because that just gives us that many more walk-in spots that we can do. So you're absolutely right, Brian. You make multiple appointments. I get why I get why you're doing that. Understood. But if you could do the right thing and just cancel out those other appointments, that means more people can show up for walk-ins.
And I just had a question about the state's registration site. And I know that you had mentioned before that you passed on a list of the people who had registered who were looking for vaccinations. Do you know, of those 90,000, how many people have received the coronavirus vaccination?
I don't know that offhand, Brian, but I can see if we have that information. You are correct, though, that, gosh, it seems like eons ago, but maybe just a few weeks ago, we had sites kind of saying, hey, we've got some openings, can you help us out? And we, again, had passed along to the various sites the pre-registration list. I do know that many of those sites, just from speaking with them, had great success in calling people or emailing people from the pre-registration list and saw a really high conversion rate. But I don't have the exact number. I'll see if we can dig that up, though.
Thank you.
Our registration platform, since you have been avid in asking, is still up and running. Folks can still register even as we are moving into walk-ins. Registering is still allowed. It's still not a bad thing, particularly if you want security around knowing, you know what, the time that works for me is 2:35 p.m. And if you want to really lock in that time, registering is still an option.
And I guess just on that note, if you were going to send some numbers our way, the 90,000 is what we've sort of been fixated on because that's what I had known. But if it's a larger number, people are still using it, I would be interested to know that as well.
Oh, absolutely. We'll see what we can find, and specifically around the total number of registrations. I know it's gone up, but at the same time, as we've moved more toward walk-ins, it's probably leveled out a bit.
Thank you.
Mm-hmm. Over to Amy Brown next.
Thank you, Dr. Shah. Just following up on the previous discussion, are the walk-in care clinics that are basically all over the state participating in the vaccine process? They already have weekend and evening hours, and they seem to be everywhere.
Could you just expand upon that a little bit more, Amy?
The walk-in centers that just are sort of freestanding places that tend to be open in the evening. Sometimes I think they're open 24 hours. It's kind of like a sub-ER kind of place. Are they participating? If someone were to go to one of those on an evening or a weekend, could they get a vaccine there?
Sorry, Amy, I just want to make sure I answer your question properly. You're thinking of like urgent care centers? Yeah. As of right now, not many urgent care providers, although they are eligible, they haven't really been in the vaccination front. But as we think about this next phase of vaccinations, that is to say, focusing on doctors' offices, places like that, places where folks are going for all of the other preventive healthcare, we're looking at seeing if we can partner with urgent care places as well.
Okay. And with Pfizer also announcing today that they're planning on filing for full approval by the
Mhm.
end of the month. I wondered if you could say anything about how that process works, what they might be looking at, how long it will likely take.
Yeah, what they're referring to there is what's called the BLA process, the biological licensing application process. And that is kind of been expected following the EUA. Much of the heavy lifting around the analysis of the safety and effectiveness of these vaccines has already been done. The EUA process already did most of that. The BLA process has some implications from a regulatory perspective, and I think that's why Pfizer is doing it. I wouldn't be surprised to see other manufacturers do so in coming weeks. But that is, in big picture terms, how it works. The process has a lot of twists and turns that FDA would have more insight on, but that's, in big picture terms, what I expect to see with all of the vaccines in the coming weeks to months.
So do you think maybe by the end of the summer it will have full authorization? And do you have a sense of how, because in the lifetime of most of us, no one's ever really, the whole world hasn't paid attention to one vaccine as it goes through the process, like this is being scrutinized. Do you have a sense of how this compares to the process that other vaccines go through in terms of a timeline?
Yeah, the BLA process, it will follow many of the same parameters that other new vaccines would follow, like the shingles vaccine, et cetera. But again, much of the analysis has already been front loaded. I'm not sure what the timeline will be. That the manufacturers really are the ones they have to make the application and then FDA has to review it. At the state level, state health departments don't really get involved with that.
Right.
Mhm.
Okay, thank you.
Thanks. Over to Chris Costa next.
Hi, Dr. Shah. A quick question for you about getting a walk-in vaccination. And it's kind of a two-part question, if you don't mind. One, I'm wondering if you've had any questions from people in the state of Maine about where they can find them. I know that a lot of us have kind of been trying to keep tabs on them from the hospital systems, which hospital systems, which locations are offering those walk-in clinics. Has there been any confusion there from Mainers about where they can go to get one? And is the Maine CDC going to do anything to kind of broadcast which sites are allowing walk-in appointments other than the mobile unit?
Sure. Chris, one of the interesting things here is how quickly the landscape is shifting. And so there are dozens upon dozens of sites across the state of Maine. And I have encouraged those sites to be flexible, to be creative, to have the leeway to do what works best for their community without needing to come to my office to get approval or even notification. And so that's one reason why, for example, sites may decide to do walk-in hours for the morning and then appointments in the afternoon and then walk-in hours in the evening. And it may change day by day based on the patterns that they're seeing on the ground. I encourage that because I want them to know in their communities what's going on and broadcast it in their community. I don't want them to wait for approval or notification from me. But the corollary of that is that sometimes at the community level, sites, hospitals, clinics are doing things that we may not find out about until I see them or get a note about them the day after. We're going to try to do our best to keep our website updated with the latest information. But if you've got questions, the safe thing to do is just to reach out to the site itself to make sure that the hours that you want to come in, they are in fact open, especially if it's evening or walk-in.
Understood.
I haven't heard much in the way of confusion, but recognizing that it really is changing in some cases just day by day. Sites experimenting with different hours, different structures, walk-in in the morning, appointments in the afternoon, and then the next day, appointments in the morning, walk-ins in the afternoon. There is going to be a little bit of a situation where the smart thing to do is to call the site to confirm everything before you hop in the car.
Okay, gotcha. And then my second question for you just kind of has to do with it's kind of bouncing off of what Eric Russell had asked earlier about the total doses administered. I was trying to go back and make sure that we were accounting for weeks when either J&J, we had a low number of doses, or perhaps, during the pause, we had to stop using it and then it was turned back on midweek. I know that those kinds of things tend to mess with us finding a clear answer on all of these things. But generally speaking, it appears that the number of total doses administered from week 18, 19, 20, obviously we're not through week 21, which is right now, but it appears they've gone down subsequently each week. Is there some reason for that? Do you know, other than the J&J issue, or and do you expect it to turn around now that we'll be able to tap into the federal unallocated pool?
Okay, Chris, I'm glad that where you ended the question, because that's an important. Let's start with what's going on, and there's it's difficult to disaggregate how much of the decrease in daily vaccination numbers that started around the 14th of April, 15th of April, how much of that is related to the J&J vaccine being paused, or how much of that would have started to happen organically anyways? That's an open question, but you are right. Week on week, vaccination numbers have started to go down. It's why you've also seen, in response, Maine CDC saying to sites, move to walk-in hours, move to evening hours, things of that nature. This is not so much a function of there not being enough vaccine. For many, many weeks, certainly starting in December up until very recently, what was our constraint on velocity was the volume of vaccine we were getting. Now, I think what is a larger constraint on rate or velocity is things like, how convenient is vaccine? To what extent are we answering folks' questions? To what extent are they getting a vaccine from someone they trust, like their primary care provider? Those are, I think, the constraints that are acting more strongly right now, rather than the supply of vaccine. Make no mistake, if we get an increase in demand, say, for example, from 12 to 15-year-olds, being able to order from other states as unordered doses will help us. If we've got demand in Maine, I am committed to getting us the supply from this new system. But more recently, I think what has been the constraint are things like convenience and questions.
Thanks, Dr. Shah.
Over next to Mike Shepard. Mike Shepard, it has been a minute.
It has. Thank you, Dr. Shah. I wanted to ask a couple questions about jails and prisons, and I guess I'll start with, do we have updates on the ones that, at least the ones at the Cumberland County Jail, and then the Women's Center in Wyndham? I think there have also been outbreaks at the Penobscot County Jail and Two Bridges, if you've got any information on those.
Yeah, so let's start with the Women's Center. They have one additional positive case. So as of this morning, they are up to a total of 27. I'll get to vaccinations in just a moment. And then at Two Bridges in Wiscasset, they are up to 30 cases. At the Cumberland County Jail, they have not had any new cases lately. And their total there stands at 67 cases. And then at the Penobscot County Jail, they've not had any new cases in quite some time. They are at 6 cases. And they're toward the latter end of their outbreak, provided they don't have any new cases. On the vaccination front, there's been a lot of activity. We've been working with a number of different provider groups, be it FQHCs or the medical groups that provide care in both the counties and the jails. If I'm not mistaken, Mike, right now, I think as we are speaking, but maybe it was yesterday and maybe it's continuing through tomorrow, there is a team that's providing vaccines at the Cumberland County Jail, a team comprised of their own providers plus some Maine CDC public health nurses, and they are offering vaccines there. At the DOC, by the end of this week, every single resident of the Department of Corrections who wishes to obtain a vaccine will have been offered the vaccine. And indeed, based on the conversation at the briefing I had with their deputy commissioner, the uptake rate within DOC facilities has been very high. I believe it was north of 85% among residents of DOC. And again, by the end of this week, every single resident of the Department of Corrections who wishes to be vaccinated will have been offered a vaccine. Similarly, every single county jail has been offered some supply of vaccine. And as we get more vaccine into the state, particularly from this unordered allocation process that you've heard us talk about at the national level, we expect to be able to provide more vaccine, not just to congregate settings like jails, but also to places like universities and others who have been waiting.
Can you go a little more into how this process is playing out in the state facilities? And it seems like there's a bit of a patchwork from what we're hearing in county jails, where they could be contracting with a provider themselves, or there could be other means of getting it rather than getting vaccines from the state and doing it that way.
Sure, I wouldn't describe it as a patchwork. I'd describe it as doing what works well for them and their community. In some jails, for some county jails, they were able to work with for example, in Penobscot, they were able to work with their community health center, PCHC, which was able to make visits to the jail from time to time to offer vaccine for the officers as well as inmates. In other situations, we've worked, or Department of Corrections has worked with the medical provider at the jail to be the ones doing the vaccinations on site. It's different for different jails because every jail is differently situated from a geographical perspective. Some already have a relationship with their community health center, as in the case of Penobscot. Some may not, and then they've worked with their own medical provider. At the DOC level, and which is our primary contact is with DOC, at the DOC level, much of the vaccinating there has been done by their medical providers.
Okay, is there any uniform responsibility for getting vaccines to incarcerated people? I mean, if it's at DOC, how is it determined? How many vaccines DOC gets on a weekly, daily, weekly, monthly basis?
Yep, much like any other provider, we base it off of how many vaccines can they do and what our total supply is. As our supply has increased, we've been able to increase the amount of vaccine that's going to DOC as well as to other facilities to get them up to their maximum weekly throughput, which I forget exactly what that is, but in effect, throughput governs how much any particular site gets.
Thank you.
Thanks, Mike. Over to Bonnie next.
Thank you, Doctor. I noticed last week that the Auburn Mall vaccine site is getting 2 trays instead of 3 trays, and it seemed a little surprising given that Androscoggin still leads the state as far as high case rates. Can you comment on whether is that supply, demand?
Well, what I can tell you first, Bonnie, is that we are allocating to them exactly what they've asked for. So we are taking our cues around what the need is in Androscoggin County based on, for example, what their request is. I believe last week they did request 3 trays. This current week they requested 2 trays of Pfizer, and that's precisely what we allocated. We are concerned about vaccination rates in not just Androscoggin County, but Androscoggin County, Oxford, Somerset, and Franklin County as well, all of which we've got more work to do there. I think what's also important to note is that the Auburn Mall, albeit a fantastic opportunity for many folks, is not the only mechanism to get vaccinated in, for example, in Androscoggin County. Retail pharmacies in Lisbon and Livermore Falls have been operating since when we activated retail pharmacies way back when. In Turner, of course, as you heard me mention, the mobile vaccination unit's going to be there. So there are continuing opportunities to get vaccinated in Androscoggin County. We're not stopping there. We also know that there's more demand, for example, from residents who may live right downtown in Lewiston. So we're trying to find ways to bring vaccinations even closer to people who need them.
Would that be through the B Street Clinic or?
Well, the B Street Clinic has already been offering vaccines in partnership with St. Mary's for months now. We're trying to see if there are even more direct ways that we can bring vaccine to folks, particularly in those areas of high need, like in downtown Lewiston.
Okay. It seems like we're hearing a little bit more about people getting COVID after they've been vaccinated. Can you talk about what the breakthrough numbers are, or people getting COVID after they've had one vaccination?
Sure. So we've still had approximately 100 and we're up to about 110 breakthrough cases now. And what's important there is that among those who have had a breakthrough case, their rates of hospitalization as well as death are far below what would be expected in an unvaccinated population. This is evidence of the vaccine doing its job, which is to say, keeping people safe, keeping them healthy, even if they're exposed to the to the virus. In many instances, what people have after they've been vaccinated is what's called a subclinical infection. They don't even know that they've got COVID. It's that mild. Among individuals who have only gotten one dose, that's not a breakthrough case. That's just somebody who got COVID before they were fully vaccinated.
Correct. Okay.
Mhm.
And yesterday I was at the Mobile Clinic in Freiburg, and it was mentioned that pretty soon the state will be announcing where people who got the Moderna shots in Oxford and Wyndham can get their second shots. Is that news forthcoming?
Well, it's those folks have already been notified.
Okay.
Yep.
Very good.
So folks who got, and so if you happen to be watching right now and you got your first shot when the mobile unit had to switch to Moderna because of the federal pause, if you were in Wyndham or in Oxford and you got your first shot of Moderna there, the mobile unit will be coming back your way to give you your second shots, both in Wyndham and in Oxford. You should have already been contacted by the Maine CDC to go and schedule your second dose using the scheduling program that Brian Sullivan has asked about on a couple of occasions, using that scheduling program. But you can also show up on a walk-in basis, although we recommend that you schedule just so we can meter out folks and not have a line form. But you can also show up on a walk-in basis, and you should have already been contacted as well.
Okay. Thank you, Doctor.
Mm-hmm. And the final question for the afternoon goes to Patrick Whittle.
Thank you very much. A couple things. Regarding the removal of the residency requirement, has there been a demand from like out-of-state visitors to access that, or is that just sort of a matter of course?
It's more the matter of course, Patrick. In my own mind, I see it as the natural evolution of where we want to go to make it that much easier. And by easier, I'm referring to two groups here. One group are those who are vaccinated. This is one fewer step that they have to abide in order to get somebody in and out the door. And so we have heard from a number of vaccination sites who have said, hey, anything you can do to make it that much faster to get people in and out, that much more convenient would be welcome. But then the other group for whom it's easier are those getting vaccinated. Perhaps many of those people will continue to be Mainers, which is great. They can get in and out that much more quickly. But as we get more folks coming back, as we get college students returning, and then perhaps even some visitors, that just is all the more opportunity for them to get vaccinated. So I see it as the natural evolution of things rather than being precipitated by anything in particular. Also, as we see more vaccine coming our way, we want to be ready to use it.
I see. This question might not necessarily be unique to our state, but can you speak at all to this sort of issue about patent protections and how sort of international efforts might be aided by changing that status?
Yeah, you're right. It's not so much a state issue, but certainly something that has been very much in the news and very much front of mind for a lot of folks as we've seen what's unfolded in, just to name one part of the world, in South Asia, in India, and to a lesser extent in Pakistan and Bangladesh, with just astronomically high rates of cases. And it raises the question of to what extent can policy changes be made to lighten the load that is required for other countries to manufacture or access vaccines. Removal of patent protection or waiving of patent enforcement has been one of those proposals. The technical term for it is compulsory licensing. It's an idea that's been used previously in the midst of another pandemic, which was the HIV crisis many, many years ago, as well as in some other instances. It's an important policy question, again, not one that is answered at the state level, but rather at the federal level. And in some experience that I've had with that when I worked in Southeast Asia, what's critical about that dialogue is to not begin and end with the discussion of patent enforcement, but also make sure we talk about the next steps, which is around the manufacturing of the vaccine. As I've mentioned to some folks, it's sort of like having going to the very best cake maker in the world. Even if that person gave you their recipe for the very best cake in the world, that doesn't mean you'd be able to take it back to your kitchen and replicate it. So as we talk about sophisticated vaccines like mRNA vaccines, if we're going to have that discussion, I recommend that policymakers talk not just about removal of patent protection, but also around providing assistance from the manufacturing of the vaccine in the locality itself.
I see. And one final thing, have we moved at all on the subject of passports in the state of Maine, or is that still in sort of the exploratory phase?
I think it's more the latter. I think it's still under the exploratory and discussion phase. There are folks who have very strong feelings about this issue on both sides. Some groups see this as the opportunity to return towards some degree of normalcy, particularly around indoor activities, which is where they would have the predominant effect. Others have concerns around data privacy and security, as well as other infringements they see. One concern that I share around this is making sure that whatever type of verification that may or may not ever come to pass across the country, making sure that doesn't mean that folks are boxed out of essential services. That's really something that I think we have to keep top of mind as we move forward with this discussion and dialogue as a country. That's not a Maine specific finding. That's just something we need to be mindful of as a country.
Got it. Thank you.
Thanks, Patrick. Well, thank you all to all of our colleagues in the media for their questions today. And thanks for all of you for spending a little bit of time to hear the latest. Again, a couple of reminders before we close. If you are in the Androscoggin County area and are looking for the one-shot J&J vaccine, the mobile unit will be setting up shop in Turner starting tomorrow for Wednesday, Thursday, Friday. And if you're in Southern Maine and the 8:30 to 5 p.m. time frame is just not workable for you to get a vaccine, the site at the Old Marshalls in Sanford, operated by York County EMA and Southern Maine Healthcare, will be offering evening hours, walk-in evening hours, this Thursday from 5 p.m. to 8 p.m. I myself am going to be there to check it out and see how things are unfolding there. There are also other walk-in opportunities across the state. For example, Scarborough Downs, operated by Maine Health, is also offering more and more walk-in hours, as is the Portland Expo. For the latest on those, I recommend you take a look at their websites or give them a call just to make sure that walk-in hours are available across the state. Now more than ever, I urge everyone to take a minute to get their shot. So with that, thank you all for your time today. I look forward to chatting with folks again, perhaps not until next week, given that I'll be down in Sanford on Thursday. But until then, please be kind and take care of one another. We'll talk again soon.